Hello, my name is Glorian Sorensen. I am delighted to be part of this workshop conducted virtually to look at the research implications of the future of work. My colleagues Jack Dennerlein and Greg Wagner contributed greatly to this presentation. We are all part of the Harvard Chan School of Public Health Center for Work Health and Wellbeing, which is one of 6 centers of excellence funded by NIOSH's Total Worker Health program. Today, I'd like to talk with you about the potential research implications of trends in the future of work in order to hopefully stimulate some discussion around how we might think differently about the research that we are planning to do. I'd like to, within this context, present to you a conceptual model that might structure some of this conversation in order to take a different look at the trends in the future of work and how they might have implications for the research that we do and the training and capacity building that we provide. We hope as well that this conversation might stimulate some discussion around priorities and recommendations for the future work that we do. First, I'd like to give you a little sense of a conceptual model that our center developed a number of years ago. This conceptual model has really framed much of the research that we have been doing. And as you can see, it places the working conditions that may exist within an organization as central within the model. That is, these working conditions are seen to really influence both worker outcomes as well as enterprise outcomes, and may be heavily structured by these workplace policies, programs, and practices. We developed this conceptual model as a process across the investigator team. Our investigator team includes representation of occupational medicine, occupational health and safety, ergonomics, sociology, social epidemiology, economics, law, policies. So as you can see, with this, we've ended up with something that really doesn't reflect any one of those disciplines, but really is an amalgam, a new way of looking at work, we hope, that actually benefits from all of these perspectives. This kind of transdisciplinary approach of coming up with something new and different as it benefits from the different disciplinary perspectives is part of what gives the conceptual model part of its utility. So as we think about starting with a conceptual model, we picture that it really provides a way of us developing a common vision and shared principles for the collaborative work that we are doing together. A conceptual model additionally frames our research directions and refines the research questions that we ask. It sets priorities for our future interventions, and it actually also provides a framework for the analyses that we might take on. We've been thinking, however, about ways that we could expand on the conceptual model that we developed, trying to place it more within a broader systems framework. And what I present to you here actually tries to do that, taking the model that we look at within the work organization or at the enterprise level, but situating that within a larger framework that considers the social, political, and economic environment, as well as the ways in which this environment may shape employment and labor patterns. These different layers actually give us a way of potentially thinking about the ways in which future work or trends in future work might actually ultimately shape worker health outcomes as well as enterprise outcomes. So I'd like to actually step back using this model to help us understand some of the trends that we've been talking about in the future of work, giving a structure that might give us a different way of looking at our research. So we might start at this social, political, economic level and take a look at a number of different trends. These bullets represent examples within this level and not necessarily an exhaustive list. We can obviously start with the changing distribution of disease, which obviously, in our current situation with the novel coronavirus, um, is a perfect opportunity to take a look at the ways in which this broader environment may shape our experiences at work and our health outcomes. The COVID-19 crisis has clearly had a marked impact on trends in telecommuting. It's increased our reliance on the digital economy and on delivery services, and it's actually blurred the lines between work and family. It's additionally had significant implications for economic trends, which may include the increases in unemployment that we're currently seeing, but may additionally shape the concentration of businesses within certain sectors, as well as contribute to our day-to-day experiences. More broadly, these trends, both economically and in terms of disease distribution, may have implications well beyond COVID-19. We've also heard other presenters speak about growing pressures from climate change and related sustainability concerns, the incredible role of changes in technology and artificial intelligence that are shaping the way that we are doing work. We also recognize that changing demographics have a huge role in who's actually at the workplace, so that there may be more aging workers or more women, more immigrants, and that public policies and regulations at this level may ultimately have significant implications for workers. We can then go to this next level, taking a look at employment and labor patterns, and we see that in many ways, these larger forces may really structure the nature of where work actually happens, so that we may actually look at people being employed in different industries, occupations, or in different size organizations. We see these trends also structuring the nature of our work arrangements. There's been increasing conversation about the gig economy, as well as the fissured workplace, and the increase in these types of arrangements that clearly have an influence in how we think about employer accountability for worker health. We also see changes in the stability of employment, whether we're looking at unemployment patterns, as well as the increased precariousness of many work arrangements or the nature of temporary work. Unfortunately, we also see a declining role of organized labor and the implications that that might have for the ability of workers to have a voice in the process. This may also have implications for trends in worker protections and the decline in worker protections that we actually oftentimes see. So moving ahead, we can actually then also look at how all of these multi-level factors are having influences on working conditions. And obviously, from a traditional occupational safety and health perspective, we've focused very heavily on the impact on physical working conditions. In addition, we may want to look at the impact on other parts of work, other aspects of working conditions, whether we're looking at the work organization or psychosocial factors. We're seeing, for example, increases in work intensification and pace, changes in work hours and scheduling that have significant implications for spillover to work-family issues, and the nature of working relationships, either between supervisors or coworkers, and how that influences workers' experiences on the job. These are also factors that clearly have an impact on enterprise outcomes, whether we're looking at turnover or work absence or healthcare costs. And we can additionally turn to how all of these factors across multiple levels are influencing the safety, health, and well-being of workers, both as we've measured them traditionally looking at injury and illness, but also increasingly looking at mental health and related well-being issues, and increasingly around looking at work's influence and intersection with family and community. One of the reasons that we've really tried to build in this new multi-leveled model is to provide a framework for really thinking about the potential effects and on and from family and community. So community might actually be situated at this broader level, and family influences may enter in at many different points. We'll talk a little bit more about that as we proceed. So I'd like to turn now to some of the implications for this process, from these trends that we've observed as we think about the future research that we might be doing, looking both at the research methods that we might need, the types of populations and samples that we want to include, the ways we think about the interventions that we might want to test, and where this takes us in terms of the future research questions that we might pose. Let's start by looking at the methods that we might need. And given the expanding range of issues that we're seeing as we look at the future of work, we see that we are really going to need to leverage the full spectrum of research designs that we have in our armamentarium. We may start, for example, with basic and etiological research, which obviously includes risk assessment, exposure assessment. But as we look at some of these broader issues, we need to incorporate social epidemiological research, as well as development of measures that we may not currently have available to us. Obviously, economic methods also may fit within this area as well. We also may need to expand our intervention research. We may need to use very systematic formative research that allows us to build intervention strategies that respond to these different levels of influence, to test our intervention methods, both in quasi-experimental design as well as randomized designs, but also taking advantage of observational studies or natural experiments, as well as case studies and certainly community-based participatory research. We can also take advantage of the growing field of implementation science. This field is really helping us develop methods that can be used to help us understand how we can actually design research studies that look at the implementation process. So as we take these interventions that have been tested in intervention research, how do we actually scale them up? What do we need to learn about dissemination processes? How do we understand how these different interventions tested in this framework might actually be implemented across diverse settings and ultimately be sustained? And then obviously, we will continue to need surveillance methods that allow us to monitor and address some of the emerging risks and outcomes that we've been talking about. This also means that we may need to consider a full range of data sources and measures, relying both on quantitative and qualitative methods, and recognizing that we may need to develop new metrics and measures. A good example of this is the work that NIOSH has been doing in the development of new measures of worker well-being that might help us assess well-being across these different life domains that people might reside in. This means that we need not only to rely on sources of data from workers and employers, but also process data that tells us how our interventions are actually implemented, as well as public and administrative data sources that allow us to monitor some of these trends going forward. This means then that as we look at our populations and samples, we need to consider some of these trends in employment and labor patterns, and to take extra steps to make sure that employers and workers across different industries or job types are actually represented, understanding that that there will be changes in the types of enterprises or situations that and sectors where enterprises might be located. We may see, for example, an increase or decrease in small and medium-sized businesses. And we know that there's been a lot more conversation around the fissured workplace and the nature of work within contract employment. This may mean that we need to do more to understand the nature of the interface between employers and workers in situations like this that we know can blur the lines around accountability for and responsibility for worker safety, health, and well-being. As we think about that, then we need to have ways that we can identify and track workers over time to look at the potential impact of these types of work settings. So as people are working either in temporary or precarious employment, how do we track them from one work site to another? What are some of the implications of unemployment? And for many workers who might be working multiple jobs, how do we assess the potential impact of those multiple job settings? We've also talked about the potential for changing demographics. Across all of this, we may need to really be flexible and innovative in our thinking about how we ensure the representation of workers across different settings and to tackle the attendant challenges of selection bias and attrition. Importantly, we also need to ensure that our methods recognize the growing disparities across workers in order that we can assess and address the potential inequalities in outcomes and risks that workers may be exposed to, and determine new intervention strategies to address some of those disparities. This may rely as well on new methods for engaging the stakeholders of our research, whether we're talking about workers, employers, or policymakers. We need participatory research methods that provide opportunities for workers' voices to be heard. And we need to identify ways that we can ensure that any barriers to participation are addressed and that we make sure that we have methods in place for engaging workers across the different types of research platforms that we may be considering. This may mean additionally exploring ways to engage organized labor, and obviously to look at some of the cross-cutting influences from the different life domains that we've been talking about. So going back to our model, I'd like to also take a look at how we've situated policies, programs, and practices within this, and to consider as part of that how we may structure our research to be able to best assess some of the interventions that we might actually try to deliver. Hopefully, within this kind of a model, we're able to use and rely on this systems level approach that incorporates these multiple levels of influences and additionally attends to these changes in employment and labor patterns that clearly structure the work experiences that many workers are having on a day-to-day basis. It also gives us an opportunity as we look at these policies, programs, and practices to determine ways that we can be responsive to changes in the working conditions across multiple settings, and additionally take into account multiple outcomes that might represent worker safety, health, and well-being. Within that, we want to be sure that we're looking at ways that some of these working conditions may spill over to influence family and community factors and the outcomes on a broader level. I've already mentioned the importance of these inequalities as part of our assessment of these intervention strategies. So then, as we turn to research priorities, we can begin to think across how we develop our priorities to address these different levels of influences, allowing us to anticipate challenges and changes in the social, economic, and political structures, as well as the changes in employment and labor patterns that have implications for worker safety, health, and well-being. All of this then lets us take a look at the ongoing central role of working conditions as the nature of work evolves and we begin to see how these working conditions shift and change as they have differing influences on worker outcomes. We can then look at this range of outcomes and potentially understand not only outcomes directly related to work, but their implications for exposures and outcomes beyond the work setting. What we've tried to do within this is to think about research questions that might be situated in each of these levels. So we've offered a few examples for each of these, but we think that there are a lot more research questions to be raised, but we thought we'd add a few ideas to kind of get the conversation going. For example, at the social, economic, political level, we might consider how economic trends might influence some of the inequalities and worker health outcomes that we've been talking about. Or we may look at the role of public policies such as minimum wages or mandatory paid sick time and how those policies might actually contribute to worker safety and health. We might also look at the ways in which changing demographics may contribute to changes in the distribution of workers' work-related exposures. Moving then to the next level at looking at employment and labor patterns, we may ask, for example, what are the consequences of long-term precarious work for the well-being and mental health of workers? Or what kinds of intervention strategies can effectively protect and promote the health and well-being of workers in the gig economy or the contract sector, as we've discussed? If we move to the enterprise level, we may ask what kinds of organizational interventions might actually be developed and tested to ameliorate the impact of increasing work intensification in terms of worker health and well-being. Or we might measure and address the effects of multiple worksite exposures as workers increasingly move to multiple jobs. Then finally, turning to the worker level, we may ask such questions as, how can we best capture and measure work-related indicators of mental health, well-being, and resilience? And how can indicators of workers' functional capacity be associated with enterprise outcomes such as turnover? Ultimately, we hope that we can look as well at how these exposures at work and outside work interact as they influence some of these health outcomes that we've been talking about. So these interrelationships remain very important. And as we consider those outside work domains, we may want to consider issues like the implications of work for financial well-being or for housing and food insecurity. How, for example, transportation and commuting demands might play a role in workers' experiences with their job setting or the length of their commute. And ultimately, how some of these work-family intersections may play out as we look at outcomes related to worker health and safety. So ultimately, we hope as well that these issues may inform our training and capacity building as we look toward the development and training of our future workforce in occupational safety and health. We believe that we're building toward what we might think of as consortium science, or maybe it's called other things, but in any ways, it's using this systems-based approach that takes advantage of transdisciplinary approaches to create new models for thinking about worker safety, health, and well-being, and their exposures to both work and non-work factors. It may, in this kind of training capacity, give us a chance to establish new platforms that might encourage this kind of cross-disciplinary collaboration and build the research opportunities that allow us to respond to some of the emerging trends that we've been talking about. It's going to require as well a breadth of skill sets to respond to these emerging challenges and trends. Obviously, we've talked about a range of research skills that may go beyond what we've traditionally thought about within our field. It may call upon the need for ability to communicate across disciplines and different audiences, and certainly will build in skills for translating our research findings to policy and practice. All of this will take leadership skills in actually leading these transdisciplinary teams of scientists from multiple disciplines. So with that in mind, we'd like to leave you with a few thoughts for priorities and recommendations. As we've presented here today, we've tried to articulate a systems level structure for framing diverse research questions that respond to multiple levels of influence as we think about future trends in the nature of work. We've examined how there may be complex interplays between work and other domains that may really come to bear as we think about how the lines between work and other life domains begin to blur. And as we live in this 24/7 demanding, pressured environment, we begin to see that our consideration of these other life domains really matters. This will require what we believe is a strategic approach for responding to these research needs. And we've presented one type of approach today in the conceptual model that we've presented. We'd encourage others to similarly develop your own conceptual framework or different strategic approaches that might be similarly responsive as we begin to develop this kind of dialogue across our different disciplines. Within this, we recognize as well that we will need a nimble approach as we design rapid responses for some changing environments. And I believe our current experiences with COVID-19 have particularly highlighted the need for this quick response to new demands on workers that allows us to uh, contribute to a larger societal dialogue around the importance of worker safety, health, and well-being for the society as a whole. Ultimately, we believe we can benefit from NIOSH's structure, looking at burden, need, and impact as a critical way of ensuring the relevance and importance of the research that we do, recognizing that it is complicated by the intersections from work and other domains, but also ensuring that we are planning for the implications for policy and practice from the very beginning of our research. That concludes the presentation. I'd like to say thank you not only to all of you who have been listening, but express as well gratitude to the full team of researchers within our center, and to thank NIOSH for their funding of our research. Thank you very much.